How can you check on the health of peripheral nerves? Well, thing is that you can check for something we call reflexes. And so what we have here is a typical reflex. You touch a hot thing. What do you see? Well, what do you feel? Well, it's going to affect these thermal receptors. And also pain receptors. And it's going to send a stimulus. So it's like, ooh, ouch, I'm touching something very hot. So it's going to send signals along these afferent or afferent neurons. So these are sensory neurons, and it's going to the spinal cord. But this is the interesting thing. Notice that this interneuron is splitting up here. So what's above your spinal cord, your brain. So it's going to send the out signal to your brain. And it's also going to send signals down here to a motor neuron. So the motor neuron is going to, that controls your flexors of your elbow joint. It's going to tell them to contract and flex, causing your whole arm to flex and withdraw. But the thing is that when you do a reflex and touch something that's very hot, do you just go, oh, this is hot, I better remove my hand? Typically, like, you don't even think, you're like, ouch, and like this at almost at the same time, right? So this is an example of parallel processing. You're getting that same initial signal and stimulus, but one is saying the ouch signal to your brain, but the other is allowing you to your elbow to flex and remove your hand without you even really thinking about the situation. So this is what we call the withdrawal reflex. So this is the cool thing about reflexes. They don't need to all go from here all the way up to the brain, wait for approval from your brain, and then your brain sends signals down to here to your flexors of your arm right here. So the thing is that in a typical reflex arc, we just have these sensory neurons going to interneurons in the spinal cord and just going straight from the spinal cord to these motor neurons. And there are other reflexes here. So again, another reflex involving pain. Say you step on a tack or a Lego. What do? Well, do you keep your foot there? Do you say like, hey, I'm stepping on something sharp, I better withdraw my foot? No, right? You kind of flinch. You do that reflex. So painful stimulus going up into a sensory afferent neuron, and then going here to the spinal cord. And this is interesting. So it does something different to each leg. Well, it makes sense that you want to do a withdrawal reflex with the foot that's actually stepping on that sharp object. So what we have here, we're flexing the knee we're flexing the knee here so that you're moving this leg away from that sharp object. So this is a withdrawal reflex. But notice that this is branching, this is going up here to the brain, that's sending the out signal. This is causing the withdrawal reflex, but notice that this interneuron is synapsing on the other side of the signal. So instead of going to the right leg, it's now going to the left leg. And then it's telling the left leg to actually extend and stand up. So it's actually lengthening the leg. So this is what we call the crossed extensor reflex. So notice that this is the opposite leg that's detecting it. So the right leg's detect the one that's stepping on the painful object. But the opposite leg is actually extending, even though it's not actually stepping on that object. It's actually compensating. And why is it important to have both of these coordinated? Well, think about it this way. What if you just yanked up your right knee and didn't do anything, and you just let your left leg be totally relaxed? Well, you would probably slip, because again, by pulling up that right leg, you're going to change your center of gravity. By doing that cross extensor reflex, you kind of compensate for that. So you kind of catch yourself and distribute your weight on that left leg. So that's why it's important to have that cross extensor reflex. And here we have the patellar reflex. We are going to go a little over time, but I only have a few more slides. So what's the stimulus? Well, what do you typically do? Well, here we have a reflex hammer, and we're trying to tap this inferior part of the patellar tendon right here. So what we do is kind of apply pressure right here. So you want it to be pretty firm, but you don't have to like totally whack it like you're trying to break that person's kneecaps. But and you're not supposed to hit the kneecaps. You're actually supposed to hit this tendon. But what you're actually trying to do is hit this tendon so it pulls it this way, and it stretches that tendon. So when it stretches that tendon, it's going to actually activate these things called muscle spindles. This is the type of neuron that detects it. So when you stretch this tendon, it actually stretches this muscle. These special nerve fibers inside the muscle are going to detect that stretch. And hey, we did talk about that as well. So if last lecture we talked about proprioception, these are one of the three major types of nerves or nerve receptors that help detect proprioception. So these are embedded in the fibers of your skeletal muscles. So when your muscle stretches, like in that patellar reflex, it's going to stretch this muscle spindle fiber. It's going to send signals up to your central nervous system, spinal cord included. All right, so we have our stimulus, the stretch, and our muscle spindle firing off those action potentials. Now it's going to go here to our spinal cord, and then it's going to go here along this motor neuron. And then this motor neuron is going to cause your quadriceps to contract. When you contract your quadriceps, what does that do to your knee? It causes it to shorten this distance and extend the knee. And this is why you have that knee jerk reflex. That's the other name for this patellar reflex. And what we have here is a complete reflex arc. So in a reflex arc, what do you have? You have a stimulus that activates some sort of sensory afferent neuron. Then you have this connection on synapsing onto a motor neuron. And then this carries out the effects via the motor neuron, and then you have a response. So this is a reflex arc. It has both sensory and motor coordination. And sometimes there are other interneurons involved, as we saw with the withdrawal and cross-extensor reflexes. But say, what if the patellar reflex doesn't work? Say you're using your reflex hammer trying to test your patellar reflex, and you're not getting any sort of kick or extension, and your patient is looking very angry and judgy at you. So what do you do if it doesn't work? I mean, it should work if your patient is healthy and has normal nerves, but what's a good backup you can do? So what you can do is the plantar reflex, and what you have here is that you take a sharp, don't take a razor sharp, but this is why you have on the opposite side of the reflex hammer, you have that metal pointed part. So heck, I don't know if you want to get your patient's foot on your stylus, but it just needs to be something kind of pointed and that you can drag. You don't want to actually cause damage to the skin of your patient. But pretend this is the foot, so you're going to scrape the lateral edge and kind of go toward the toes right here. If that was your patient's foot, like if this was the big toe, yeah, you kind of like scrape it like this. So then what you do is what we typically have is if someone kind of tickles your feet, what do you kind of so the things that a normal sign in adults is that you would have it kind of as if you stepped on something. You're kind of arching your foot away from it. You're pointing your toes and flexing it toward the plantar region. So if you kind of have this hollowing out of the foot away from that sharp object, is that what you have? That's a healthy sign. So that's negative for the Babinski sign. So this is a healthy adult response. If you have that kind of that plantar reflex being scraped, then they'll try to move their toes and arch their foot away from it. But this is interesting. In infants, they actually do the opposite. So instead of arching their foot, they actually start to flex their toes upwards. So instead of flexing their toes toward the plantar region, they actually, especially the big toe right here, this is classic Babinski sign. So this is healthy in infants, but as your nervous system develops, you shouldn't see this in adults. So when an adult has, if you see this type of movement in an adult patient, this is abnormal and could be indicative of some sort of damage. So this is what we call the Babinski reflex. So this is, I know you might be very this is a new, how am I supposed to memorize this? So this is why it took me a while to go through a lot of stock images, but I like this picture. So think of it like a baby in skis. Now, which way are skis pointed toward the toes? Do the toes of the ski go up, or do the toes of a ski go down? Notice that the toes of the skis go up, right? This is the way I like to think of it. The front part of a ski goes upwards. So think of a baby in skis. So when a baby skis, the toes point upwards. So that's the way I think of it. Babinski's sign is when the toes point upwards when you try to elicit the plantar reflex. But again, this is not normal adults. So again, this is why I like this picture. So how does this relate to that patellar reflex? Well, again, if you're trying to whack your poor patient and then trying to get their response, is there no response? Is there some sort of damage? Well, if you just go down here and you're able to get a healthy negative Babinski normal plantar reflex? Well, if you get a normal reflex sign, that means everything's pretty much intact. So if everything's intact from here all the way here, then there's probably no lesion. But if you do get that positive Babinski sign where the toes are going upwards, hey, maybe there is something wrong along the way. So this is why if you're having trouble, like I remember I was doing a class demonstration and I think it was a football player, but I mean, his knees and or everything was thick. But I was just remember trying like people with like really developed tendons. Sometimes it's harder to actually like put enough pressure where you can actually cause a patellar reflex. But yeah, but I was able to get it eventually, but I just need to put a lot more force. So if it is someone who has very tough or very thick tendons, you can also do the plantar reflex as a backup because again, if this is intact, most likely the patellar, all the nerves involved in the patellar reflex are intact, and maybe the patient is just being difficult. Because this is the thing too, is like reflexes are involuntary, but if the patient is trying to mess with you and trying to contract this muscle, I mean, they can dampen the reflex. So that's why there's also something called the Yendrasic. I don't know if I'm pronouncing it correctly. I know nothing about Hungarian, but something called the Yendrasic Maneuver starts with a J. But they have them like clench their teeth and interlock their hands and pull like this. It's an old maneuver, but what are you doing with that? Well, if your patient is focusing on doing that clenching and trying to pull with the upper body, they're sending all of these central nervous system brain signals to those muscles. So if they're occupied and kind of distracted, or actually there are two main theories behind that, and I forgot the other theory, but I know the theory that I was taught was that if by distracting the brain, it prevents the brain from messing around with the actual quadriceps and all the muscles involved in the patellar reflex. So that's the theory I heard. I think there's two competing theories. I have to look it up again. But yeah. All right, so I think that's it. And again, I'm sorry for going over time. So Wednesday will be pre-recorded. It will be online again, just like how Friday was. But I believe next or Friday is a regular class. So I'll see everybody on Friday. Let me double check my calendar. But yeah, thank you for attending. And I know, can you believe Thanksgiving is already next week? I'm like, oh shoot. Yeah, Friday's normal. And same with next week, Monday and Wednesday. All right, so thank you for attending, everyone. See you on Friday. Again, Wednesday will be pre recorded.